Good evening, Ma'am RC. Good evening, classmate. So, I'm Idrix B. Lorenzo, your reporter for tonight. My report is all about the stopping of breathing and shock. So, breathing that stops from any cause is called apnea. Slowed breathing is called bradypnea. Labored or difficult breathing is known as dyspnea. Apnea can come and go and be temporary, and this can occur with obstructive sleep apnea. For example, prolonged apnea means a person has stopped breathing. If the heart is still active, the condition is known as respiratory arrest. Ito na yung life-threatening event para sa isang tao na kailangan na natin tumawag ng mga medical attention and first aid. Prolonged apnea with no heart activity in a person who is not responsive is called cardiac or cardiopulmonary arrest. Sa infants and children, yung most common cause ng cardiac arrest nila is respiratory arrest. Sa adults naman, opposite. Yung cardiac arrest ang nag-leads to respiratory arrest. Common causes of breathing difficulties in infants and young children includes asthma, bronchiolitis, or yung inflammation and narrowing of the smaller breathing structures in the lungs. Choking, encephalitis, or brain inflammation and infection na nag-a-affect sa vital brain functions natin. Gastroesophageal reflux or heartburn, yung nafe-feel natin na minsan kumikirot yung banta sa dibdib natin. Next is holding one's breath, meningitis or inflammation and infection of the tissue lining the brain and spinal cord, pneumonia, premature birth, and seizures. Next naman is yung common causes of breathing trouble or dyspnea in adults. Ito yon yung allergic reaction na nagkakos sa tongue, and throat, and other airway swelling. Parang namamaga yung mga tongue, throat, ganun. Next is yung asthma or lung disease, cardiac arrest, choking, drug overdose, especially dahil sa alcohol or mga painkillers, anesthesia, ganon, or other depressant. Next is yung fluid in the lungs. Next, obstructive sleep apnea. Other causes of apnea, nag-i-include din siya sa head injury or injury to the neck, mouth, and larynx or yung voice box natin. Heart attack, irregular heartbeat, metabolic or yung body chemical, mineral, and acid-base disorders or metabolic disorders. Next is near drowning, stroke, and other brain and nervous system or disorders or yung neurological. Next is injury to the chest wall, heart, or lungs. Dahil doon hindi tayo hinga or nag-stop yung breathing natin. Next naman, paano natin malalaman kung kailangan natin humingi ng tulong sa mga medical professional? Ito, seek immediate medical attention or call your local emergency number such as 911 if a person with any type of breathing problem, such as yung becomes limp, has a seizure, is not alert or loses consciousness, wala na siyang malay, remains drowsy, or turns blue. If a person has stopped breathing, call for emergency help and perform CPR. Kung alam niyo kung paano mag-CPR, pero kapag hindi, huwag niyong gagawin, baka mamatay pa. Char. When in a public place, look for an automated external defibrillator or AED and follow the directions. So, we're done na sa stopping of breathing. Next naman is yung shock. So, shock is a critical condition brought on by the sudden drop in blood flow through the body. Shock may result from trauma, heart stroke, blood loss, an allergic reaction, severe infection, poisoning, severe burns, or other causes. When a person is in shock, his or her organs aren't getting enough blood or oxygen. Ibig sabihin, parang may hindrance na. Hindi nila nakakakuha ng enough blood or yung oxygen para makahinga yung isang tao. If untreated, this can lead to permanent organ damage or even death. Ito yung minsan nagkakos ng, ang tawag doon, yung half body na hindi na nila nagagalaw. Parang ganun. Tapos, ito rin yung pwedeng maging sanhi ng death ng isang tao. Next naman is signs and symptoms of shock vary depending on circumstances and may include cool or clammy skin, pale or athen skin, bluish tinge to lips or fingernails, or gray in the case of dark complexions. Next is rapid pulse. Next is rapid breathing, nausea or vomiting, enlarged pupils, weakness or fatigue, dizziness and or fainting, changes in mental status or behavior such as anxiousness or agitations. If you suspect a person is in shock, call 911 or your local emergency number. Then immediately take the following step. Ito yun. Lay the person down and elevate the legs and feet slightly unless you think this may cause pain or further injury. Yung gagawin niya nga yung parang ipapatan niya yung legs niya sa medyo mataas na bagay o pwedeng upuan, ganun. Next naman is keep the person still and don't move him or unless necessary. Parang ihiga mo lang siya, wag mo siyang i-move ng i-move. Next is begin CPR if the person shows no signs of life such as not breathing, coughing, or moving. Mag-CPR ka na if nakikita mo na yung tao na hindi na siya humihinga, wala na siyang um, pulse rate, ganon. So, kapag hindi ka marunong mag-CPR, hingi ka ng tulong sa mga marunong mag-CPR. Next is loosen tight clothing and if needed, cover the person with a blanket to prevent chilling. So, yun yung parang, di ba minsan nakasuot ka ng sobrang tight na damit. So, kailangan mo yun i-loosen. Tapos, yun nga, sabi cover with the blanket para hindi siya mag-chill. Next is don't let the person eat or drink anything. Huwag mo siyang papakainin. If you suspect that the person is having an allergic reaction and you have access to an epinephrine autoinjector, use it according to its instructions. Ayan. If the person is bleeding, hold pressure over the bleeding area using a towel or sheet. Yun nga yung tatakpan mo yung nagdudugo para mag-stop yung bleeding niya. If the person vomits or begins bleeding from the mouth and no spinal injury is suspected, turn him or her onto a side to prevent choking. Ayun. Wag mo siyang hayaan nakahiga lang. Itagilid mo lang siya. Yung tagilid lang. Wag mo siyang parang nakayuko. Ganun. Tagilid lang. So, that's all for my report po. And hope you enjoyed and may natutunan po kayo sa report ko. Thank you po.